Welcome. My name is Odessa Apple, and I am here today with Dr. Linda Williams, and we will be discussing understanding food insecurity and food deserts.
Well, thank you, Odessa. I'm really happy to be here. I think this is a very important topic
Definitely.
for our agency, and in the time we have today, I'm going to talk a little bit about healthy food systems and some of the breakdowns in those systems
Okay.
that cause food deserts. Talk about food insecurity, share the definition and some data. Then I'm going to talk about food deserts, some differences in the dynamics of urban and rural food deserts, and then talk about some core competencies and the research base needed for our employees to address food insecurity. And finally, I'm going to talk about some collaborative partnerships that I believe will be helpful to us in addressing this issue.
Wonderful.
Now, when we think about food system involves everything from production, processing, distribution, consumption, and disposal. Now, what happens with food deserts is that something goes awry in the food system. And it generally has to do with distribution or access and then consumption patterns. But with healthy or sustainable food systems, all of these processes are working together in ways that provide food access to consumers and also in ways that promote environmental stewardship. In other words, we're not doing something to feed ourselves that's going to make it difficult for our children to feed themselves. And I also like to mention that in sustainable food systems, effective food systems are not harmful to the employees or to the people that are working in production, the workers. That's something that we've been reading a lot more about lately. Now, food insecurity. What are we talking about? That term is just thrown around
It is. It
a
certainly is.
lot. So, what are we talking about when we talk about food insecurity? Well, the United States Department of Agriculture defines food insecurity as a situation of limited or uncertain ability to acquire acceptable foods in socially acceptable ways. And so, just another way to say it is that the state of being without reliable access to a sufficient quantity of affordable, nutritious food. And I'm going to talk about a little bit later on um, in the discussion some of the choices that food insecure individuals have to make in terms of, do I buy food this month? Do I pay my utility bill? Do I buy my medicine? So all of these factors come into play when we look at the dynamics of food insecurity. Now, Map the Meal Gap Study is an interactive map that was developed by Feeding America, a group called Feeding America, and it analyzes data, looks at data from all over the country, and then you can go to a specific state, county, and look at the insecurity rates.
Wow.
So nationally, there are about 45 million people. That's 1 in 6 Americans experience food insecurity. That's a lot of people.
That certainly is.
the Texas food insecurity rate is 17.6%, which is higher than the national average of 15.8%. And Texas ranks second in terms of food insecure individuals. Particularly alarming is the child food insecurity rate in Texas of 27.4%, because we know, you're a nutritionist, my background is in child development, human sciences, we know all of the negative consequences. Poor performance in school, inability to pay attention in class that occur when children are food insecure. And so you can see that Texas is significantly higher than the national child food insecurity rate of 21.4%. And in 13 Texas counties, many of those counties are in the valley. 1/3 or more of the children live in food insecure households. And 3 Texas counties, and they would be Harris, Dallas, and Tarrant, rank among the top 10 nationally in terms of food insecurity. And my work with food deserts and food insecurity has primarily been concentrated in Harris County for a number of years. So I'm well aware of some of the conditions that exist in Harris County with food deserts and health disparities, higher incidences of health disparities in those communities. So, what are we talking about when we talk about food deserts? So we're moving from food insecurity to food deserts. And food deserts are neighborhoods that have limited access to affordable and nutritious food, and they tend to be composed of primarily low-income consumers are of color. These communities are very economically distressed. Many of them don't have cars, and so transportation to a grocery store is problematic. And what you will find in these communities are convenience stores where you're likely to find food that's high in fat, sodium, calorically dense, but not much in terms of nutritional quality. If you look at the difference in urban and rural food deserts, because you know that there can be food deserts in rural areas, the difference is the high concentration of individuals. In Harris County, it's estimated that about 500,000 people live in food deserts. And where these food deserts are located has been documented by several reports. In rural areas, food deserts tend to be the result of communities that may have been dependent on one economic venue, and that business goes out of business, and people don't have access to food. But in urban areas, the communities are economically distressed, and so there are a lot of policy issues that created that. There's food justice issues. There's institutional racism, kinds of issues that created what we see in those food deserts. And the United States Department of Agriculture Food Environment Atlas showcases access and proximity to grocery stores in Texas or in any other state. One of the, as I mentioned before, defining characteristics of food deserts is socioeconomic. They're mostly found in communities of color and low-income communities. And numerous studies have documented that wealthy districts have 3 times as many supermarkets as poor ones do. And people's choices about what they eat are severely limited by the options available to them and what they can afford. And many people, when discussing food deserts and looking at the high obesity rates and why the smaller stores in food desert communities don't have fresh produce, say it is a matter of consumer choice. It is a matter of supply and demand. But if you really think about what determines the food choices that we make, what we have access to, and what we can afford. And you can take, you being a nutritionist, I know you know this, you can take $3 and buy 300 calories of something highly nutritious, fresh produce. You can take that same $3 and buy 3,000 calories of something that is high fat, high in sodium, calorically dense, but it is filling. And so families that are in this situation have very difficult decisions to make about how they spend their food dollars. The alarming problem is they're making short-term decisions, and the reason that they're making those decisions is obvious. They're trying to feed their family. But the long-term consequences in terms of obesity, diabetes, hypertension, has devastating consequences on individuals in those communities and on society in general.
Yes, certainly.
So when we think about some of the core competencies needed by extension professionals to address hunger and food insecurity, extension has a long history of involvement in food systems work. In fact, I would say that the state of Texas and the nation owes a lot to extension for building the food supply that we have. Our efforts have primarily focused on production and consumption, teaching people how to grow the food and then teaching people what to eat. And we have not historically looked at some of those other food system issues that have created some of the problems that we have. And so in order to successfully address all of the broad spectrum of food insecurity, extension must examine all of the aspects of food access, financial insecurity, including various aspects of poverty and health disparities. And as we think about where the knowledge base exists for extension to do some kind of that work, many times it is outside of the College of Agriculture and Food Sciences. For example, you will find it many times in the School of Social Work. You will find it in schools of public policy and public affairs. And so we need to be partnering with some of these other entities to make sure that we are not addressing food insecurity in isolation. And we need to be able, one of the critical competencies is that we need to distinguish between programmatic strategies that alleviate the symptoms and those that are effective at eliminating the causes of food insecurity. And when you talk about food security, you are talking about families having enough to eat without having to rely on emergency or temporary food sources. Not that we don't need those, we do, and they're doing some great work and really addressing. In fact, the food bank in Houston won the National Food Bank of the Year for some of the good work that they're doing. But we need to think beyond just getting them enough food for the day. We need to think about what's going on in those communities. Chronic poverty, community development, lack of jobs, and we need to be partnering to bring the expertise that we have to bear on the total problem. So really what we're talking about is a systems approach to holistically addressing food security. And a systems approach means that we look at all of the variables that influence. We look at the individual family and resource needs. We look at community resources that are available. We look at community characteristics. And this can be a very critical issue because when you're talking about community characteristics, you're talking about how does the community view hunger and problems? Do they view it as the blame the victim kind of syndrome, or do they view it as this is everybody's problem that we need to address? What kinds of healthcare systems are available in the communities that really address the needs of high risk individuals? So I guess to sum it up, we've got to think about the big picture
Welcome. My name is Odessa.